All right, a controversial breakthrough when it comes to gene editing. A team of scientists now say that they have safely repaired a mutation that causes a heart defect in human embryos. Well, the experiment had a 72% success rate, fixing 42 of the 58 embryos that were used. But now it is, as you can imagine, sparking a debate about the potential for so-called designer babies. Joining us now is clinical nurse specialist Alice Benjamin and senior health writer for Newsweek, Jessica Firger. Good morning, ladies. Thank you for being with us.
Good morning.
All right, so as I said, this is just the beginning of this debate, but I have no doubt it's going to become more and more controversial about what you can do to really change a baby. Alice, you say originally this was meant to help with heart disease.
Absolutely. So this study was actually done to prevent hypertrophic cardiomyopathy. They looked at a group of embryos, they did some genetic changing, and they were able to, like you said, 72% of the time, alter the genes. But we have to be very careful because this is during the embryonic period. This is up to 8 weeks after conception. Most women don't even know that they're pregnant during this time. Right. And just because we have the science, we have to be very delicate with how we use this because it's very, very powerful.
As I mentioned in the intro, I mean, you could ultimately get to a place where you have designer babies. Jessica, I'm going to read you the statement. This is coming from concerned scientists about this. They say at this time, given the nature and the number of unanswered scientific, ethical, and policy questions, it is inappropriate to perform germline gene editing that culminates in human pregnancy. What are your thoughts about this?
I think that right now we're having the wrong conversation. We are decades and decades and decades away from being able to alter the DNA of an embryo and for a viable pregnancy. And I think the conversation we should be having now is the fact that there are virtually no regulations for using this gene editing technology. It's at a very early stage. I think a lot of the coverage has really spun this in a way to make it seem like there are scientists growing babies in labs that, that they've completely redesigned.
You know, Alice, so it does give you a sense of the direction that things could potentially go when we talk about living in a world with designer babies. I mean, now that I'm pregnant with a girl and about to have her in a few months, it makes you really think about this. And, obviously for health reasons, you want to help your baby, but at the end of the day, I want whatever I'm given. I want that baby's a miracle.
Absolutely. We want the best thing for our child, and I'm 100% behind that. However, we have to be very delicate because, although this study was looking at, hypertrophic cardiomyopathy, we have to be careful because this will open the floodgates and open Pandora's box to designer babies. I mean, the next thing you know, with this technology, especially in the wrong scientist's hands, we'll be ordering our babies, right? Just like we go to the drive-thru and order what we want. I want a redhead, I want a blonde, I want green eyes, and we have to be very careful with this because there is a natural order to things, and once we make changes in such an early period, we still don't know what could happen. I mean, we're going to be potentially creating a superior race within a race because we're, removing disease, but are we also going to make them smarter, stronger? And again, with this science, this was done in a lab, so this was something that was planned. What about children who are parents who decide to have babies the natural way? Will, these babies be superior to those babies? There's just too much happening here, and we have to have some strict guidelines. We have to have some clear definition as to what we're doing, can we do this, and is this something that's even going to be equitable if we can actually pull off this technology?
Jessica, quickly, last word. Does anything concern you about this?
I think that the main issue is that the scientific community isn't stepping up to figure out what to do about this, figure out a way to regulate it. Currently, the NIH...
Well, that's because we...
Currently, the NIH will not fund research that results in a viable pregnancy with gene editing. But I think that...
And they shouldn't.
Right, because we're not ready to do that because this is only research that's happening in a lab, and we're so far away from being able to do that.
Well, certainly the debate is just beginning. Absolutely. I have no doubt that it is going to be quite controversial from here. Just a lot of sensitivities. Alice, Jessica, thank you for being with us this morning.
Thank you.